In the state of Wisconsin for 2020, there is a policy change that impacts how cost sharing is handled in our BadgerCare Plus program and Medicaid programs. This is a rule that takes effect January 1st, 2020 through June 30th, 2020, the first half of 2020, that spells out that providers may not collect member copays for services where a copay otherwise would have been collected for BadgerCare Plus and Medicaid members. Now, if you're reviewing our BadgerCare Plus eligibility handbook, there is a chapter that spells out when copays are appropriate, and this does not apply to all members. There are exclusions for children and tribal members and certain carve-outs that are identified in the rule. But there is a grid of copays that are assembled along services such as chiropractic services, durable medical equipment, hospital inpatient or outpatient treatment, over-the-counter drugs, and more. They vary by provider. Like we said, there are exclusions that apply, and they're typically on the range of 50 cents to a couple bucks, up to $3. The rule is actually going to suspend the collection of those copayments. And this means that if any provider actually does collect a copay in that time, they have to very quickly reimburse the member. Now, there still may be copays for services received before January 1st, 2020. So if a member is being asked by a provider to pay a copayment, look at the dates of service to see if it is appropriate or if the suspension should apply. Now, just like the copayments don't apply to everybody, the suspension does not apply to everybody. If you are somebody that is receiving services through the SeniorCare program in Wisconsin or the AIDS Drug Assistance Program or even the Chronic Disease Program, this does not impact you. Those copays will continue to be collected from members as they were in 2019. Now, additional information will be forthcoming as we learn more. We'll share that with you. In the meantime, watch the mail for a member update. You will get a letter from the Department of Health Services that spells out this change. Individuals also, and if you're an assister out there, you might print a couple copies of this. Make sure that members know that this change is in effect, that they do not owe copays after January 1st, 2020. And some of the handouts that the Department of Health Services has already made available that we link to in the description below can be printed and handed out to members so that they have it in writing. Should they be asked for a copayment, they can point to something that says they are not owing that money. Now, if members themselves have questions, member services is the right place to go. If providers have questions, provider services is the phone number you should be using, and we share those on the screen. Now, linked up in the description below, we share the ForwardHealth Update that talks about this change. We also share the section of the BadgerCare Plus eligibility handbook that reminds you who is not subject to a copayment right now and what the schedule of copayments for services through 2019 will look like. Thanks for watching.